Okay, well, hi everyone. Welcome to ClinicalTrials.gov for Librarians. My name is Marga Malachowski, and I'm an Education and Outreach Coordinator for the network of the National Library of Medicine in Region 7. So my office is located at UMass Chan Medical School in Worcester, Massachusetts. So here's our agenda for today, and we have a handout. Rebecca could put the link to the handout in the chat. When you click on the link, it will download to your downloads folder as a Word document. So we will begin with an overview of clinical research and explain the significance of ClinicalTrials.gov. I will go through my slides for about a half an hour, and we'll talk about how ClinicalTrials.gov is used and by whom, and we'll address the importance of registering trials and reporting results. Then we will spend the second half of the class exploring ClinicalTrials.gov through a live demonstration of the website. You can choose to sit back and watch, or you could follow along by opening up a new tab on your computer, or if you have a second screen, a second monitor, you could do that. You can even use your phone to search ClinicalTrials.gov. So after the demonstration, we will do a class exercise together, and we will wrap up by answering any other questions that you might have. So, all right, I am going to turn off my video here, and we will get started. Let's start by hearing from you. What is your experience in using ClinicalTrials.gov? Let us know in the chat. Are you an expert user? Are you familiar with it but want more tips? Do you rarely use it and need a refresher? Or is it completely new to you? So let me open up the chat so I can see. Familiar, brand new, rarely use it, need a refresher. Okay, used once. Okay, rarely, familiar, but need some tips. Okay, not an expert. All right. So this class is designed as an introduction. So those of you who have little experience with ClinicalTrials.gov are in the right place. For those of you who might think of yourselves as experts or very familiar, I hope you'll be able to use today's content to think about how you would instruct others to use ClinicalTrials.gov. Oops. There we go. Let's move on to our overview of clinical research. What is it and why is it done? Clinical research is medical research that studies people to understand health and disease. This research relies on human volunteers, also called participants, to learn how the body works, how diseases develop in people, how the body responds to different treatments, and which behaviors may increase or reduce the risk of illness. Regardless of their outcomes, these studies contribute to our understanding of health and help us to improve how to prevent or treat disease. There are two main types of clinical research: clinical trials and observational studies. In clinical trials, researchers assign participants to get one or more interventions to test what happens in people. This is why clinical trials are also called interventional studies. Interventions can be a drug, a medical device, or a behavior. Researchers may compare two drugs to see which works better or has fewer unwanted side effects, or they may compare a drug to a placebo or compare getting a particular treatment to getting no treatment. Sometimes researchers will randomly assign participants to an intervention, and neither the participants nor the research staff will know to which group they have been assigned. This is called masking or blinding, and it helps to ensure that the results are looked at fairly. In observational studies, researchers do not assign participants to get an intervention. Instead, they collect information from participants or look at the data that was already collected to observe how that data affects health outcomes. If there is an intervention in an observational study, participants were already using it as part of their regular health care or their daily life. Let's examine these 6 key points about clinical trials to understand them a bit more. I will go through each of these points over the next several slides. Point 1, informed consent. Informed consent is an ongoing process. You might be familiar with the act of obtaining informed consent from participants before they enroll in a clinical trial. The informed consent document includes a description of what will happen during the study, how much of the participants' time the study will take, any payments the participants will get from taking part in the study, or conversely, any costs the participants may need to pay, and perhaps most importantly, the known benefits and risks of taking part in a study. Informed consent is not limited to this one act during the enrollment period. It is a process involving communication, transparency, and respect for the participants' autonomy throughout the duration of a clinical trial. Even after signing an informed consent document, a participant has the right to withdraw their consent and leave the study at any time and for any reason. Point 2, research. Research for clinical trials happens in many ways. Studies can take place at hospitals, clinics, research centers, or universities. They may be conducted in person, over the phone, or online. Research could last a few days or weeks, or it could last for years. In some clinical trials, all participants will get the intervention being studied, while in others, only those assigned to a particular group will get it. Point 3, healthcare. Healthcare continues for participants. In most studies, participants can keep seeing their regular doctors. Sometimes they may need to change or limit their usual healthcare, such as stopping a medication they take. If needed, research staff will work with the participants' doctors to make sure that being in the study will not cause problems. Point 4, health problems are reported to research staff. Research staff will explain to participants what to do if they have health problems during the study. The research staff often includes doctors and nurses who will work with the participants and the participants' regular doctors. A group of experts may also oversee what is happening in the study, and if they have a safety concern, they will alert the researchers. If serious health problems happen to participants during a study, the researchers may stop the study altogether. Point 5, researchers collect data from participants during the study. This data collection may be done through surveys or questionnaires, through imaging like X-rays or MRIs, by taking measurements such as height, weight, or blood pressure, or by obtaining samples of the participant's blood or tissue to look at in a lab. Researchers may need to collect data from participants many times or only a few times. Different countries have different rules about how researchers can use each type of data that they collect. In the United States, informed consent documents will often include a statement on what the researchers plan to do with the participants' data and how the data will be maintained and stored. And point 6, researchers analyze data to answer their research questions. Some studies will include a statistical analysis plan describing in detail the methods that will be used for data analysis. Having a clear, comprehensive, and transparent plan like this supports the reproducibility of research. Okay, let me pause here for a moment and answer any questions that you might have on clinical research.
We'll give them a moment to type, but there's nothing in the chat box yet.
Okay.
Elliot says, admirably clear explanation.
Oh, excellent.
There's a question, how are clinical trials funded? So I'm not sure if you're getting to that at some other point.
Yeah, we might get into that. And the short answer is multiple ways. All right. And I will show you where to find, some of the funding information when we get to the demonstration. All right, let's move on. There are many benefits from having access to clinical trials information through ClinicalTrials.gov. Access to information helps researchers meet ethical obligations to human subjects. It informs future research and research funding decisions. Providing access mitigates information bias, such as the non-publication of results data, and we will talk more about that later. ClinicalTrials.gov creates access to information that allows for evaluation of research integrity, such as adherence to protocol, and could prevent trial duplication of unsafe or ineffective interventions. ClinicalTrials.gov creates access to data that supports evidence-based medicine and enhances patient access to clinical trials information. So what is ClinicalTrials.gov? ClinicalTrials.gov is an online database of clinical research studies and information about their results. It is the world's largest registry of publicly and privately supported studies. So again, things that are funded publicly through tax dollars and also privately supported studies taking place in all 50 states and over 200 countries and territories. So you can think of clinicaltrials.gov as a library of clinical research studies. It collects, stores, and organizes information as study records, which anyone can search and access. As of December 2024, which is the most recent date for statistics, clinicaltrials.gov was receiving about 90,000 visitors per day and 2 million unique visitors every month. So I have a question for you. Does the United States government review or approve the safety and science of studies listed on clinicaltrials.gov? You can let me know in the chat, yes or no. And a big hint is that the answer is on the slide. Yes, or right, no. It is important to point out that while clinicaltrials.gov provides access to study data, it does not own that data. The study sponsors and investigators are responsible for the data that appears on clinicaltrials.gov, not the United States government. The National Institutes of Health and other federal agencies only approve the studies that they fund. The National Library of Medicine does a limited quality review of the study information that the sponsors and investigators submit for inclusion in the database, but neither the funding agencies nor the National Library of Medicine does a scientific, legal, or ethical review of all the studies listed on clinicaltrials.gov. It is the responsibility of the study sponsors and investigators and their institutional review boards, or IRBs, to ensure that the science is sound and the study is safe. So who does clinicaltrials.gov serve? The website serves 3 user groups that are external to the National Institutes of Health, patients and their advocates, which include healthcare professionals and caregivers, data submitters of trial information, and researchers representing academic, nonprofit, and commercial organizations. Internal groups served by clinicaltrials.gov include various National Institutes of Health policy and oversight teams, information specialists, reviewers, librarians, and developers. So what about you? Which of these external user groups do you currently support or would you like to start supporting and learning about clinicaltrials.gov? Let us know in the chat. Do you work with patients and their advocates, including healthcare professionals, data submitters, researchers, or all 3 groups? Take a look. Researchers, all 3 groups, data submitters, patient and advocates. Okay, Systematic review teams, we will talk a little bit about that later. Students and faculty like to expand to data submitters. Great, thank you. Let's look at the 3 external user groups in a little more detail, beginning with the patients and advocates group. The original intent of ClinicalTrials.gov was to enable more patients to gain access to trials that might help them. For both patients and healthcare providers, the website provides a comprehensive list of ongoing studies and offers a centralized place to search for trials by condition, location, and other trial characteristics. The website also has supporting materials in plain language to aid in understanding the study record data, resource links for learning more about topics and treatments related to studies, and educational information on terminology, the clinical trial process, and the importance of participating in research. The second group of users is data submitters. These are the study sponsors and investigators who submit trial information to ClinicalTrials.gov. Some studies are required by laws and policies to be submitted to ClinicalTrials.gov. Other studies, like observational studies, sponsors and investigators can choose to submit them or not. Data submitters are responsible for ensuring information is updated throughout the life of a study. They must update records at least once a year, and certain types of changes, like adverse events, must be documented more frequently. Submissions and updates are done through the Protocol Registration and Results System, or PRS. Learning how to use PRS is outside the scope of today's class, but we do have links in your class handout. The third group of users is researchers. Researchers can use ClinicalTrials.gov to search for information on active and completed clinical trials, to examine individual study protocols to assist them in developing new methodologies, to locate data that reveals trends in clinical research to help shape decision-making, and to download study record data for analysis. The class exercise that we will do later will get you thinking about ways that you might support research teams at your institution. So, what about librarians? Librarians can use ClinicalTrials.gov in a variety of ways to support these user groups. They can be their organization's ClinicalTrials.gov search expert with skills to retrieve trials by condition, location, or phase, identify unpublished research for inclusion in a systematic review, guide patients and caregivers to ClinicalTrials.gov when they are looking for trials related to their health condition, and conduct training sessions for researchers, students, and clinicians on how to effectively use ClinicalTrials.gov. Let's talk about reporting requirements, and then I will stop for another question break. Ideally, the complete results of all scientific studies would be made available to the public in a timely way. We would expect this because significant public funds are invested in clinical research, and the individuals who volunteer for clinical studies are putting themselves at risk for these results. However, in practice, between 25% and 50% of clinical trial results remain unpublished, even several years after completion of a study. Of the trial outcomes that are published, they are often reported and published selectively, depending on the nature of the results. There are numerous ways in which the evidence that appears in the journal literature can misrepresent or underreport the full range of collected data. Researchers or funders can be dissatisfied with the study results, or journal editors may select studies with more interesting results over those that show no significant effect of an intervention. Details of a study may be selectively reported. For example, changes to a trial protocol may happen mid-study and not be fully reported in a publication. or information about serious adverse effects may be omitted. Sometimes authors may simply run out of space in a publication to fully report their results. In the end, selective publication contributes to distorting the evidence base. It makes it difficult to determine the true value of a treatment. Several policies and regulations have been established over the last almost 30 years now to increase the accessibility to scientific study data regardless of publication in the journal literature. This improves transparency and accountability in research and study reporting. Before ClinicalTrials.gov existed, information about clinical trials was scattered across various sources, making it difficult to find studies of interest and learn how they were conducted or track their progression. In response to calls from patient advocacy groups, Congress passed the Food and Drug Administration Modernization Act of 1997. The resulting public database, ClinicalTrials.gov, launched in the year 2000. And since 2000, additional regulations and policies have gone into effect. This graph shows the growth of clinical trials from when it was suggested as part of the FDA Modernization Act in 1997 through December 2023. When the ClinicalTrials.gov website launched on February 29, 2000, nearly 26 years ago, it contained 2,119 study records, and now that number is well over 500,000 study records. Despite the large numbers of study records, only a fraction include study results. Remember, study sponsors and investigators are responsible for updating the study records, including submitting results data. Potential penalties for not submitting results of clinical trials include a notice of non-compliance on ClinicalTrials.gov, civil monetary penalties of up to $10,000 per day of non-compliance, and the withholding of NIH grant funds. These penalties bring serious consequences, not just to the individual investigators, but to their institutions. So given the many regulations and the potential penalties, why isn't the number of studies with results in ClinicalTrials.gov even higher? Well, there are two major challenges in submitting results data. And the first is a lack of awareness of the results submission requirements. That is, what needs to be submitted and when. The second is the lack of detailed study knowledge by whomever is submitting results. The data submitter really needs to be someone very familiar with the study and the data. As trusted information partners, librarians can support researchers and data submitters by sharing compliance information related to ClinicalTrials.gov. Librarians can do this in the same manner that they support compliance with the NIH public access policy and the data management and sharing policy. So if someone at your institution is submitting results for the first time, they can follow the PRS guided tutorials for step-by-step instructions. And we have included the link for those tutorials on your class handout. Okay, let's have another question break, and then we will move on to our live demonstration.
All right, so there are tons of questions in there, and Christina has answered, I think, all of them. And I don't know, I just want to look at a couple things that I pulled. There were questions about, do some grant funders require the use of ClinicalTrials.gov? And part of that was NIH requires NIH awardees to register their studies, and some other funders do as well. I'm just going to pick out some highlights. One person asked how ClinicalTrials.gov itself was funded, and Christina answered that it's funded as part of NIH through their annual appropriations as negotiated and passed by Congress. There are a couple of questions which I don't think we've gotten to yet. Consequences, or maybe we did, yeah, for not, see, what consequences are there to data submitters who don't update their records? Have you talked about that?
Yes, so there's the penalties of $10,000 per day, withholding of NIH grant funds,
Yeah.
and a notice of noncompliance.
Oh,
And I
yeah.
will point out when I show the website where you can look for more information about regulations.
Okay.
Do you
And
mind if
then
I jump in
go ahead.
just for a moment? Let me lower my hand. So there are penalties that can be levied. It doesn't happen often. Those are all actually made public. You can find those on the FDA website. And I'd have to go and check the website. I believe the letter, there's like they get like a warning letter, and then there's like the official letter of noncompliance. And so a lot of times, if there haven't been very many of these like actually issued yet. So once that warning letter comes out, a lot of organizations will actually come into compliance after that. But one of the biggest motivations for a lot of data submitters is actually the possibility that they might not be able to publish. So I apologize, I can't recall if you hit on this already, but the ICMJE, or International Committee of Medical Journal Editors, require for all of their member publications to be able to publish in any of those journals, you are required to have prospectively registered your study. So that's one of the biggest drivers of registration and results submission. Can't publish if you didn't do it.
Yeah.
So a follow-up to that or on that, there was a question, do all unpublished results stay in the database or is there a protocol to remove them? So,
Um, so there's I think we might be conflating a couple of different things. So not all studies are required to be registered. And so for any studies that are voluntarily registered, um, the data provider then has the option of whether or not to submit their results. So we don't have like a bunch of results lingering in the database unpublished on the back end. What we have published is what we have, unless they're in progress, like under review by ClinicalTrials.gov experts. So, the sort of to simplify that a little bit, not all studies are required to be registered. So we have lots that are voluntarily submitted, and of those who are voluntarily submitted, it's up to those people whether or not they submit results. For studies that are required to be registered, they are also required to submit results. So you'll see that we have far fewer studies with results than we do overall registrations. We have well over 500,000 studies registered now, but a very small portion of those studies actually have results. I think I was a little bit wordy and rambling. Hopefully that all made sense.
thank you. Yeah, so that is all I've pulled out from questions right now.
Okay. All right. So, and I think some questions might get answered when we're looking at the website. So it's just about time for our live demonstration. The URL is on the slide and Rebecca will drop it into the chat. And again, you can sit back and watch the demonstration, or you could follow along by opening up a new tab on your computer or using a second monitor or even using your phone to search ClinicalTrials.gov. Note that if you do use your phone, the layout of some of the content may look a little different from what I'm showing on my monitor. So here is the roadmap for our demonstration. We will begin with an overview of the homepage to get familiar with the main features of the website, and then we will perform a basic search, learn how to use the filters, and I will share a handy search tip involving PubMed. Then we will do a class exercise together using a research case scenario and wrap up things by answering any remaining questions. So I will move over from sharing my slides to sharing ClinicalTrials.gov. So here we are at the homepage, ClinicalTrials.gov. In the center of the web page are search boxes. We can search for studies by entering terms into these boxes, and we will do that in just a moment. But first, we'll take a quick tour of the homepage to get oriented. Above this search area is a brief disclaimer saying the United States government does not review or approve the safety and science of all studies listed on this website. There is additional information if you click on the plus sign here, and you can click on the hyperlinked word disclaimer to read the full disclaimer. I will close that now. Up at the top of the page, there is a site menu. So moving from left to right, the Find Studies tab and the Study Basics tab is where you will find information on how to search, helpful tips, how to read a study record, the glossary, and patient resources. The Submit Studies tab is where you can find help on the PRS and learn how to apply for a PRS account. The Data and API tab has information on how to organize, search, and retrieve data using the Application Programming Interface tool. The Policy tab has information on clinical trial reporting requirements as well as some data element definitions. So here's where you would find more about reporting requirements. This digs it more into the regulations and policies that have been developed over the past, nearly 30 years, and definitions of some of the data elements. And then About. The About tab is where you can read the latest ClinicalTrials.gov news and the release notes for recent and future upgrades and changes to the website. Up in the right corner, we have the login for the PRS to register a study or to submit results. And if we move down to the bottom of the page or the screen here, we have two options for providing feedback to the ClinicalTrials.gov team. We have a yellow feedback button here, which actually is on every page in ClinicalTrials.gov. And then underneath the help column here, there is a link to give feedback. The ClinicalTrials.gov team reviews and analyzes feedback to help them identify bugs and user requests, and then they integrate this feedback back into the design and development process to help shape future releases and features. Also, under the help column is the link to customer support, and this would take you to the NLM Support Center and a list of FAQs that are specifically related to ClinicalTrials.gov. I will scroll back up here, and we will start by doing one of our searches. So before we start this search in these boxes, I want to point out to you this link that says Expert Search. If we click on this, it takes us to an alternate search interface that is more conducive to constructing, editing and viewing complex search queries. Performing an expert search is outside of the scope of today's class. I just wanted to point this out to you that this exists, and there is a help on constructing complex search queries, a link right here. But I will take us back to the home page and we will do our basic search. There are 4 basic search fields or filters, and as it states up here, all filters are optional. You do not need to put something in every single box to run a search. The first box is condition or disease, and if you click on these little information blue buttons here, anytime you see that, if you click on that, it opens up the glossary on the side. So we can see the definition of what in this database, what condition or disease means. And we see that it means disease, disorder, syndrome, illness, or injury that is being studied. It also may mean other health-related issues such as lifespan, quality of life, and health risks. All right, so let me X out of that. So for today's demonstration, I want to look up studies on breast cancer. So I will type in breast cancer, and you can see while I am typing, and I'm not using any quotes or anything, just a straight keyword search. So you've noticed that a few suggested terms have appeared on the drop-down list. ClinicalTrials.gov incorporates predictive typing, so we could choose one of these terms, or we could just go with what I typed in, which is what I will do for today. In the second box, we can enter other terms that may be important to our search. For example, we can enter a name of a drug or something that's commonly associated with a condition or disease, and we will leave this box empty for now. Our third box is intervention or treatment, and this is the process or action that is the focus of the study. This can be a drug, medical device, vaccine, or something non-invasive like education or diet. And we will leave this box empty. The fourth box is location. ClinicalTrials.gov has integrated Google Maps API, so you can search as narrowly as a street address. For right now, we will keep things very broad and I will put in United States, and you will see that in red it says, please select a location from the drop-down list. Because the Google Maps API integration, this is the one field where you do have to select from the drop-down list. So I will click on United States here, and you could see in green it says location selected. Beneath these four basic search fields is the study status, and we can select either all studies or recruiting and not yet recruiting studies. The default selection is all studies, and we will leave it there for now. At the bottom, we have the option to select more filters to further refine our search. We will look at these filters in a few minutes. For now, we will click on the search to run this basic search. And our results show up on a new screen. This is a search results page, so let's get familiar with what is available to us here. Our search retrieved nearly 7,000 studies related to breast cancer that are in the United States. If I click on the plus sign over here, it will show us all the synonyms that were also automatically searched. ClinicalTrials.gov uses the United Medical Language System as a dictionary for these synonyms. The terms we entered, breast cancer, and all these synonyms were searched across 7 fields in the study record, including the title field, the condition field, and keyword field. I will come back up to the top of my search results, and I will close out the synonyms. All right. So the display order, and there's a button here that says display with a gear. The display order is defaulted to relevance. And relevance is determined by best match to our search terms and the synonyms. Proximity is also considered if location has been entered. In our case, we did enter the United States, and so that's also considered. You can change the display order to newest first, and these are the same amount of studies. They're just reshuffled to display newest first. I will keep my results to relevance. The default view of our results is card view, and you can see up here at this button, we are in card view. There is also a table view, which again, this is all the same information, it's just laid out in a table. I will go back to our card view. So in the card view, we see the study title, which is hyperlinked to a full study record. Above the study title is the NCT number. This stands for National Clinical Trial Number, and it is a unique identifier that gets assigned to each clinical study upon registration in ClinicalTrials.gov. The status button indicates the stage of the study. We can see that shows up in every result. And also on this page, we are seeing the location. Above our results are action buttons. We can download and save studies. We'll dive more into this later. We could also set up an RSS feed. But right now, let's look at ways to refine our search by applying additional filters. To the left of our search results are filters to focus our search. Our original search terms, breast cancer and United States, are here, already populated in the boxes, so we could easily refine our search. I am interested in studies that address dense breast tissue, as tissue density can impact the detection of breast cancer. So I will type in dense, breast tissue into the box now, into this other terms box. As we scroll down, we will see that there are additional filters. We have not yet recruiting, active not recruiting, completed. Terminated means the study stopped early and will not start again. Then we have enrolling by invitation, which the researchers are inviting specific participants. Suspended, the study stopped early but may start again. Withdrawn, the study stopped early before enrolling its first participant. And unknown, the study has passed its completion date and the status has not been verified in the last 2 years. So for today, let's click on completed. Next is eligibility criteria. You can refine your search by the participant's sex, age, and health requirements. This is followed by study phase and study type. And here you can see that there's interventional and observational. We also have expanded access. These are also referred to as compassionate use studies, and they are a way for patients with serious diseases who can't participate in a clinical trial to gain access to a drug or medical device that hasn't been FDA approved for treatment. If we continue down the list, we have study results. For today, let's filter with results. We already filtered for completed. And then we have study documents, funder type. So here is where in your searching, and also on that main page under the first filters there, you can filter to funder type and also date range. And if we keep going down, we will find more ways to search. If you had a specific study or a sponsor that you were interested in, you could search that way. Okay, we've got 5 filters and we will apply those filters. Now let's take a look at an individual study record. So I will click on this first result here. Molecular breast imaging as a screening tool for women with dense breasts. So now we are looking at a study record page. At the top, we have key information. We see that this study has been completed. We have the NCT number. We have the sponsor, which is the Mayo Clinic, the responsible party, who is Deborah Rhodes of Mayo Clinic, and the date when there was the last update for this study. If we continue to scroll down, we have 4 tabs. The study defaults tab is the default view. So I'm sorry, the study details tab is the default view. So we will look at that first. The study overview gives both a brief summary and a detailed description of the study. This study compared the sensitivity of conventional mammography to molecular breast imaging for detecting breast cancers in women with dense breasts. Over on the right, we have some key dates and numbers. The study started in 2005. It was completed in 2010, and it enrolled 969 participants. As we scroll down the page, we have a list of the interventions that were used in this study, and we have resource links provided by the National Library of Medicine. Medline Plus, the drug information links out to Daily Med, and we also have a link to the FDA. So patients could explore these links to learn more about topics and treatments related to the study. Under those links, we have contacts and locations. This study had just one location, the Mayo Clinic in Minnesota. If it was a multi-center trial, you could click on this interactive map to see all the locations at a glance. The next is an important section, participation criteria. And this is where you will find the key requirements that people must meet or the characteristics they must have to participate in this study. Eligibility criteria consists of inclusion criteria, which a person must have to participate, and exclusion criteria, which will prevent a person from participating. Common types of eligibility criteria include age, sex, and health requirements. As we scroll down, we have the study plan where you can learn how the study was designed, what research questions the investigators wanted to answer. We see that this study was set up as a single group assignment. And if we scroll down, we see that it had just one arm. An arm is a group or a subgroup of participants in a study. All participants received 3 interventions: molecular breast imaging, conventional mammography, and they also received a drug, an injection of an agent used in nuclear medicine imaging. If we go further down, what is the study measuring? We find primary outcomes and secondary outcomes. The primary outcome measures are the measures that researchers consider the most important for evaluating the effect of an intervention or treatment. Most studies have 1 or 2 primary outcome measures. This study has 2, diagnostic yield and the number of participants with a cancer diagnosis 12 months after the intervention. Secondary outcome measures are still of interest, but they are less important than primary measures, and most studies will have several of these. This study has 3 secondary outcome measures: sensitivity, specificity, and recall rate. Next, we have information on the collaborators and investigators for this study. And under this, we have information about publications. These are publications in scientific journals that are related to the study. There are 3 types of publications that can appear here. The first are general publications, which are entered by the data submitters and may be about anything related to the study, like background or protocol. The second are publications that are auto-indexed from PubMed. These are automatically created by PubMed based on the NCT number. And the third are publications related to the study results, which are provided voluntarily by study submitters. And here we have an example of a study results publication. Moving down, we have study record dates, which track the progression of the study and summary results submissions. And then further down, we have additional information, including a record history where you can view and compare the different versions of the study and what changes were made over time. And then we have terms related to this study, listing keywords and additional mesh terms. All of these were supplied by the research teams when they registered the study. So ClinicalTrials.gov does not perform any indexing of study records, and it does not apply mesh terms to the submitted studies. Lastly, we have a section for drug and device information, study documents, and helpful links. And this is where you could access the study's protocol and statistical analysis plan and the informed consent document. This study shares a Mayo Clinic YouTube video on molecular breast imaging that patients and family members might find informative. So let's click the back to the top button and take a look at the next tab. So again, we have 4 tabs here. Here is the researcher view. This has the same information that we just looked at under the Study Details tab, but it's organized and marked in a way that is useful to data researchers and journal editors. So it looks different, but it's all the same. When results are available for a study, the Results Posted tab, this Results tab is labeled Results Posted. So let me click on this. The information here includes findings from the study and a summary of any health problems that happened during the study, but it does not include any conclusions or interpretations of the results. You must review publications for any conclusions or interpretations of the results. The results overview provides basic information about the study, and then we have the study record dates, followed by the participant flow. This shows the progression of participants through each arm, through all the stages of the study, and it includes the number of participants who started the study, who completed the study, and who dropped out of the study. Baseline characteristics lists data that was collected at the beginning of this study from all participants in each arm or comparison group. These include things like age, sex, race and ethnicity. Note that no information is included that could identify an individual participant. Baseline characteristics also include any study-specific measures that were collected from all participants. In this study, we have menopausal status, mammographic breast density, and risk factors for cancer. Outcome measures, if we keep scrolling down, shows the data that researchers collected during the study. Each outcome measure table has a blue heading with the name of the outcome measure, in this case, diagnostic yield. Whether it was primary, secondary, or other measure, we have primary here, and the time frame in which the measure was taken. And here we have 12 months after mammography and gamma imaging. We would have to scroll quite a bit to get to our next section on adverse events. So I will just click on the hyperlink here over to the side. It will jump us down the page. So this section summarizes all the unfavorable changes in participant health, whether serious or not, that happened during the study or within a certain amount of time after the study ended. Note that adverse events may or may not have been caused by the intervention being studied. Here we have no adverse events. We can also review any all-cause mortality. Oops, sorry, I went too far. Here we go. And this is how many people died for any reason during the study. And again, no mortality was recorded for this study. So following this, we do have limitations and caveats, any barriers or limits that may affect the results of the study. There are none specified here. Again, the collaborators and investigators, the publications list, which is the same that we saw on the study details tab. And then we can have some miscellaneous information. Here we have some agreements tied to the study. Once again, I will go back to the top using this button here. And we can look at this fourth tab, Record History. This is a more direct way to view and compare the different versions of the study and changes made over the course of the study. So if this study was of interest to you, you would have the option to download or save it. I will show you how to do that now. Here on this page, we have an option to download or save. If I click on the download button, I could choose which file format I would like. I could choose the fields I would like to download, and then I would click on download to do that. To save, I would click on save. And if I looked up here, up at the top under the PRS login button, I will see My Saved Studies 1. If I click on this link, it will show me that I have saved this, this study. So what can I do on this page? I can save up to 100 studies, and I could download selected studies. So the way you would do that, again, you would just click on all of the studies that you wanted to download. Again, this is the opportunity to download it in whatever format you would like and with whatever fields you want. You can also copy a link by clicking on this and then pasting that link into an email or into a Word document or anything where you want to hang on to that link. And then if you feel like you are done with this, you can also remove your saved here. And then now under My Saved Studies is 0. So these will be, you can save a maximum of 100 studies at a time, and they will be saved there until you delete your browsing data and clear your cookies. So I think I will go back home and we will do one more search in ClinicalTrials.gov. So, and this is where I'd like you to get your hands in here. So we will be looking for trials on breast cancer that are actively recruiting near you. So here I will, and today I will just select breast cancer as the disease or condition. And here I will put in, I'm at UMass Chan Medical School, wherever you are. You can type it in. You can decide, how far you'd be willing to go. I will go up to 100 miles. And then I need to change this to recruiting and not yet recruiting. And if you did this along with me, you could let me know in the chat how many trials you got as a result. I will click on search here. And I got 244 within 100 miles of where I am. I'm going to open up this I want to show you a really cool search tip that happens in PubMed, and then we can, and we'll do our case study, and then we'll have time for questions again. So right now, I will open up PubMed, and Rebecca, maybe you could drop PubMed, link to PubMed in the chat.
Sure, one sec.
Okay, so we've gone through all of the basic searching for ClinicalTrials.gov, and I showed you where to access the expert searching if you are curious about playing around with that after today's class. But now I want to show you a handy search tip in PubMed. So what we will be doing is we'll be using a field tag to quickly and easily filter our PubMed results to publications that have NCT numbers. So a reminder that that's the National Clinical Trial Number. That's a unique identifier that's assigned to every clinical study upon registration in ClinicalTrials.gov. And we did include the steps for this search tip on your class handout. We will use what's called a secondary source ID field tag. Secondary sources include publishers, research institutes, and a variety of commercial and nonprofit organizations. So our secondary source for this PubMed search is ClinicalTrials.gov. And it is important to put, to do the URL, the clinicaltrials.gov. If you don't do the .gov, it's not going to work. Then you will do a bracket, an S for secondary source, and or secondary, what is it? Yeah, secondary source, an I for ID, and another bracket. And for today, I will put in vertigo as my search term. So again, I have clinicaltrials.gov in brackets SI and vertigo, and I will hit search. And I get 141 results. Just to demonstrate, I will click on my first result. And if I scroll down below the abstract, I see the trial registration, clinicaltrials.gov, and here is my NCT number, and that is hyperlinked. So I could click on that, and it brings me to the study record for this particular study that is related to the journal article that I just pulled up the citation. So that's a fun little search tip for you. SI means secondary source ID. All right. So I will go back to my slides here because now we have time to do our class exercise together. Okay, so let's search clinicaltrials.gov for studies that might be helpful to our fictitious research team here. This exercise is also on your class handout. So we have a trauma center that's interested in designing a study examining the use of virtual reality, or VR, with adult burn patients during wound dressing changes. The research team recalls hearing about a couple of studies that utilized VR, but it doesn't know if the studies looked at reduction in pain, anxiety, medication, or some combination. So the team wants to know what similar research has been completed or is being currently conducted. And so, again, there's no right way to do this search. You can use, open it up on another tab or second monitor. I am going to use my phone here to search along with you. So again, it's up to you which terms you would like to use, and I will ask you to just share some of what you find in the chat. So I think I'll start with just burns and condition, virtual reality and other terms. I think I'll filter to adults and older adults, maybe. Okay, so if somebody found a novel virtual reality for wound care in adolescents, 58 just for burns and virtual reality, 57 results for burns and virtual reality. Yeah, so just by looking at the titles, do you see that the studies looked at pain or anxiety? Okay, somebody added wound dressing and that limited to 10. Oh, virtual reality pain distraction was a term that somebody used. And then if you're scrolling through your results, are you seeing any that have, any studies with results within your results? Okay, so somebody is seeing 10 results, seeing pain and anxiety. Yeah. Yeah, I did find one with results using an interactive virtual reality system to distract burns patients during burn treatments. Okay. All right. So that was a quick look, but I hope it got you thinking about how you could use ClinicalTrials.gov. And I want to show you another resource that might be helpful to you. Okay, so somebody was also using the term anxiety in their search and got 17 results. All right, well, thank you so much for doing that with me. Before we finish and before I take more questions, NNLM has created a user-friendly guide to support systematic review work. So, and this link, the link to this or information about this is on your handout. So you will come to a web page that says Systematic Reviews, NLM products to support your search. And here in the ClinicalTrials.gov button, there's one on PubMed and also on ClinicalTrials.gov. You will find step-by-step help for building complex search strings, guidance on how to identify studies with unpublished research results, and information on how to document, save, share, update, and reproduce search queries. And on this website, there is a handy 2-page PDF that you can bookmark or print for quick reference to ClinicalTrials.gov features and search commands. So I wanted to make sure you knew about that. And then also, thank you for learning with us today. And Rebecca will put the link to the evaluation into the chat. And I'm still here for questions, but I just wanted to give this to you. Please fill out the evaluation form. Even if you're not claiming MLA-CE, your feedback really helps us improve our training program. And if you are claiming CE, completing the evaluation is the first step. And after you complete it, the CE code to use on the MLA website will appear. So thank you again. And are there any questions that I can take right now?
Yeah. I do just want to point out, so I did put the link to the handout again into chat. That was also included in your reminder emails. So if you can't get the link, the reminder email, it's in your reminder email. So some questions here. Does the autocomplete feature indicate that there are matching records in the database or only that someone else typed in that search string before? And that might be a Christina question. I know in PubMed it means that somebody just typed it in the past.
I'm actually checking with one of my developers on this particular question right now, so I will actually come back to you on that one.
Okay, sounds good. Let's see. I'm going through here. Christina answered one of these. So there was a question, if you type dense breast tissue, would it also retrieve records with dense breasts? So is it similar to PubMed, which does the enhanced mapping? And that would probably be a Christina question.
Yeah, I would think.
I'm so sorry. I was looking at the chat at something
Okay.
else. Can you repeat that for me?
Yeah. So if you type in dense breast tissue, or really anything, would it also retrieve records with dense breasts wording? Or, as PubMed does enhanced mapping, it does lunch and lunches, so, or is it really just going to look for what you put in?
So it depends on where you're using that term. So I dropped a link in the chat that goes to a page called Search Areas. So excuse me. So if you're on the website and you go into Data and API, and then you go into the page called About the API, you'll see multiple resources there about documentation and data structure. And you'll see one of them in particular is called Search Areas. And there is a little note, maybe it says in the fourth paragraph, it says fields producing synonyms are marked with like a check mark. And that means that when you use those particular fields to search for a term, the search will also search for the synonymous terms as well.
Okay, that's
So,
good.
for example, like I know condition is one of them. So let's see, it's acronym, brief title, official title, condition, intervention, primary outcomes, brief summary, and it goes from there. Like I'm not going to read all of these out to you, but there are certain fields within the search form that are searched for synonymy.
Thank you for talking
Yeah, of
about that.
course.
Um, let's see. So, and I think that I think the answer might be yes to this, and I don't know if you want to go to back to clinical trials screen there,
Sure.
because the question is, are some fields in the download menu? So if you were to choose to download, like you could just put anything in there, breast cancer, or
Okay.
um, are some fields in the download menu selected by default? And I think when,
Yes. So if we do, I just selected two
yeah.
of them, and I could choose my file format, and then there are some that automatically are selected. You can deselect and select others and then download this way.
Okay, good. And then there was another question. Are there persistent links to search results in ClinicalTrials.gov? So, you just, if you cancel out of that one, you
Yep.
just did a search for breast cancer. I realize it's very large, broad search. But
Um,
so there's a link to the search up on top, but the set of results, I don't know if that, and other than saving your results.
so if I save the results and then I do these, I would imagine they would copy both. Two studies copied to a link, and the link will, oops, come on, will
We
take
were
you
trying to
to,
read that.
and
Yeah, that's just a confirmation message. It only stays up on the screen for a few seconds.
okay.
So if you were to like, go into your address bar up above and hit Control V or paste, right click and paste that
Okay.
link, then you're going to get the search
All
results
right,
with
there
just
it
those
is.
two studies.
Okay. All right, good. Thank you. Let's see here. Hold on. Well, here's one, say, for a systematic review. What is the difference in results between searching clinicaltrials.gov or going directly, searching clinicaltrials.gov directly versus searching Cochrane Central? So none of us are Cochrane experts necessarily, but do you have any thoughts about that, Christina?
Oh, I am not familiar, so I cannot answer that
Yeah.
question.
Yeah, I'm not sure. And I don't know if people register. Is Cochrane a database where people can register studies? I don't think so. So I don't know. Let's see. Okay. Oh, so there's a clarification to this question. So this person who asked about persistent links to results meant persistent links for searches with multiple filters applied. Would the URL for the search work as a persistent URL?
So yes, although the results would change. So we have
Yeah.
new records added to the registry every single day. Um, so the link might still work, but your results are going to change.
Yeah, that makes sense. Um, okay. And somebody wants instruction. So hold on a second about claiming CE at MLA. And that is one of the hardest things we do
Yeah.
is try to claim CE there. So what I'm doing is I'm putting a link to a 1-minute YouTube video on how
Yes.
to claim CE at MLA. And so I just put that into um, chat. And let me also put the link to the evaluation in there one more time. Hold on. I did that. Okay, people are giving big thank yous. Okay, Marie Thompson says Cochrane includes records from clinical trials, but also contains records from PubMed and other registries. So um, Cochrane might have um, include studies from other registries, and PubMed will have something about studies, but only if obviously they've been reported and published. So it's all about being published, I guess. There's the video. When you enter the C code, it thinks for a little while. Yeah, please watch the video. It's so unintuitive over there at the MLA website.
People have found the video to be very
Okay.
helpful.
Yeah. Yeah.
I have sent
Okay.
it out myself to numerous people.
And Dana is here. Dana Johnson is here to say she was able to get credit for the course, so we know it works. Um, okay. Right. And you don't have to be a member of MLA to get credit, but you do have to create a free guest account if in order to get credit or a certificate. So, okay. I think
Hey,
that's, yes, go ahead.
I was just going to go back to one of the questions, and this comes up. I want to say it comes up every single time, and I never have the answer at my fingertips, and I need to document this for next time. So when you are entering terms on the search form. So if you're entering something into, for example, condition and disease, so you started to type breast cancer and then you see, this list of suggested terms that comes from the compendium within the database for that particular field. So if you're searching breast cancer, you're getting suggestions of other terms that have been included in the condition disease field throughout the database. And that auto-populate is not available, or the auto-suggested terms are not available for every field, but they are available for many fields.
Okay, good. Thank you.
Oh, I think there was a question about IDs as well, study IDs and the NCT number. Did that get answered? Because if not, I'm happy
It
to.
did not because I may have missed that.
Oh, okay. So the NCT number is called the National Clinical Trial. It's duplicative, but the National Clinical Trial Number, or we call it the NCT number. So that is the ID that we uh, generate for every record in the database. And that is how, we index studies like PubMed publications. So if somebody includes the NCT for the study in their publication, we auto-index based on that to the ClinicalTrials.gov website. The other IDs that you see are provided by the data submitter. So, you'll see NIH grant numbers and you'll see, IDs that are specific to the, institution that's registering the study. So if it's from, a university, that secondary ID could be their university ID for the study. And so that's some of the information that you'll find in regards to all of the IDs that are that can be included with a particular record.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.